plastic surgeon. That means I do cosmetic surgery from head to toe. That includes injectable treatments and non-surgical treatments, which are taking over our field, but also surgical treatments of the face and breast and body. So, these products are very important to us. The SkinCeuticals products and skincare is critical to our results after surgery. We like to get all of our patients on regimens before surgical treatments and continue them afterwards. And it's important to have a high-quality skincare line that is safe to use and is effective, so that it's going to help you get better results and is not going to result in complications. So, I'd like to start. I was tasked today to talk about active ingredients, but I'd like to start with a little personal story because I think it's important to relate the importance of the skin as an organ, and also the importance of skincare and of having a quality skincare line like SkinCeuticals. So I've been in practice about 19 years in South Florida, and about the time that I joined Miami Plastic Surgery about 5 years ago, we were just starting to partner with SkinCeuticals, and I was kind of having a skin crisis of my own at the time. So as we all know, skin is the largest organ in the body, correct? And when you have problems with your skin, it can cause major problems. It can cause systemic problems. So I was having problems with surgical gloves and with any exam gloves, like a lot of healthcare workers do. Very often people get reactions to gloves. As a surgeon, you scrub your hands maybe 50 times a day. You wash your hands when you're seeing 30, 40, 50 patients. You put on 40 or 50 pairs of gloves on and on. So there's a ton of exposure. We all have exposure, and something we'll talk about a lot today is free radicals and environmental exposure. These are all toxins in the environment, and we all have our own toxins that we're exposed to depending on our lifestyle and our profession and what we do. And as a surgeon, when you're scrubbing your hands and removing your skin barrier and you're being exposed to all of these chemicals that are in all of the exam gloves, primarily that we use in the surgical gloves as well, that can begin to cause problems. So most healthcare workers, when they have problems with surgical gloves or with exam gloves, it's the chemicals that are applied to the products to dry them during the manufacturing process. It's not latex. There's not a lot of latex that's used in exam gloves and surgical gloves these days. So I was having this problem, and it was really becoming severe, so that I was really at risk of having to be out of work for a while. And around that time, I found SkinCeuticals, and I was treating myself with all kinds of over-the-counter products. Then I got help from some dermatological friends of mine, and saw an allergist and was skin tested. And when I was skin tested, I reacted to something called cocoaminopropylbutane. Right? Who can even say that? What is that? Unfortunately, there's an abbreviation, CAPB. Go home and look at the soap or the shampoo or the conditioner you use. It's in just about every soap, shampoo, conditioner there is. Every single thing I was using over the counter, putting on my skin, had this product in it or had other things that I reacted to. So once your skin breaks down and you start to have issues, your whole immune system gets activated. So I was reacting to all of these common products. Fragrance is in just about everything, right? It's in a lot of our skincare products, right? And corticosteroids. What do you put on your hands or your body when you get a rash? Steroid creams, right? All these things I was reacting to. So I had to go start at square one. So I don't know, I'm dating myself a little bit, but there was an old Batman movie. I think it was the one with Michael Keaton, when the Joker was poisoning all of the cosmetic products in Gotham City. And there was a scene where the newscasters, there would be a previous scene, and of course they were all made up and they looked like Hollywood stars. And then the Joker's poisoning everything, and everyone's dropping dead with a big Joker smile on their face. So they couldn't use the products anymore. So there was another scene, and they all had acne, and their hair was a mess, and they had no makeup. And that's where I was. I mean, I was really, really desperate. So fortunately, I got it under control, and I had to look at every single thing I was putting on my skin. I was reacting from products I was putting in my hair, around my scalp and my ears, all over my body. So fortunately, I found like everyday products that I could use. And at that time, we were starting to partner with SkinCeuticals. So, I found products that we use for our surgical patients that are safe to use immediately after surgery. Surgery is the same way. We're causing all this trauma to the skin and to the body, and our immune systems are activated and turned on, and anything that is exposed to the skin may cause a problem. Okay, so we like to use these products to help us in healing, but they've got to be good quality products. Fortunately, this line is of that level of quality. So the mission of the SkinCeuticals line is to provide quality skincare products backed by science, they say. Okay? So advanced skincare products. So what does that mean? That means that they have to have the proper concentrations to do what they need to do. This may be very low concentration. So a good example of that is the antioxidants we use. And this is one of the the principles of skincare is antioxidants. And vitamin C is one of the primary ingredients. So you've got to have proper concentrations of vitamin C, and you have to have pure vitamin C. That's another quality of the antioxidants. If it's not pure vitamin C, it's not going to get absorbed. You have to have the right pH level. So a lot of these antioxidants have an acid combined with them, and if you don't have the right pH, that product's not going to be absorbed. So these are truly pharmaceutical grade products, and I witnessed it myself because I was having these problems. And you can put these on broken, damaged skin, and that's what they're designed to do, is to improve it, not to make the problem worse. And we use these products after our surgical procedures, and they're safe and they're effective, and they allow better healing and better results. So the other part of it, it's advanced skincare products and then backed by science. So this line of products is fantastic. It was founded on research, founded by an investigative scientist, a research scientist, who basically produced, published, and patented the research that developed the formulas for vitamin C and for topical vitamin C products, the first ever, right? And this is what we all use these days. So that sort of was the birth of this skincare line, and their sort of flagship products were the vitamin C-based antioxidants, and all of the antioxidants. And these are not just products that are produced based on what everyone else has done. There's research behind all of these, and published research that can be referenced that shows the benefits of the products, improves the benefits of the products. So, again, these are critical to us when we're dealing with surgical patients and healing and potential complications and trying to get improved results. And we love it for that reason. So there's three basic principles in any skincare line, right? Three basic foundations, right? The first is prevention, right? And this is all of your antioxidant products. So everybody should be using some type of antioxidant for prevention of continued aging. And these are extremely effective. And then the next is what we call correct. So we say prevent, correct, and protect. So if you take anything away from what we're talking about today, is that everybody needs three basic products: an antioxidant for prevention, for protection. For correction. The primary thing that just about all of us could use as soon as we have signs of aging of the skin is some type of a retinol. Okay, that's going to help with fine lines and wrinkles. It increases the turnover of cells in the skin and really gives us constant, fresh skin. So for the prevention, the antioxidant; for correction, a retinol; and then protection is the sunscreen. So the majority of the aging effects and the exposure that we have to free radicals is from sun exposure and UV light, and we can all use sunscreen to prevent that. So thank you all to all of our hosts today. Thanks for all of you, our guests and our honorees, and we'll be around to answer questions later on. And what we do in aesthetic medicine, we get new products and procedures every day. There is, to me, I see a gap. I see people coming in on a daily basis asking for a particular thing. There's a gap in aesthetic medicine right now. And there's a great SkinCeuticals product that can help fill that gap. So if you're interested in that, come and talk to me afterwards. Share that with me. Thank you.